we are experiencing a surge in cases of scabies in United Kingdom. Scabies is quite common and is caused by a very small parasite, even smaller than a pinhead. It's not because of poor hygiene or being dirty. The most common presentation of scabies is itchiness, which is more likely to happen at night time. Usually, the symptoms start a few weeks after the time of infestation. Scabies can spread very easily from person to person. Scabies usually spread by direct skin-to-skin contact. However, it can be occasionally transferred by using the same clothing or bed sheet. It can occur as a family outbreak in children, especially at school or sleepovers. In certain places, such as care home or nursing home, the risk of getting the infection is higher. And finally, in adult population, it can be transferred by direct contact, especially during sexual intercourse. The commonest locations to find burrows, including hands, especially between fingers and between toes, around the rest area, also on skin folds, including armpit, on the breast, around private area. In my clinic, I use a device called dermatoscope to have a better look at burrows, because the main differential diagnosis would be between scratch marks and burrows we see in scabies. In certain patients, the presentation might not be just itchiness and skin burrows. In people with immunosuppressant conditions such as HIV, those patients on age extreme like neonates or elderly people with comorbidities, we might have some other presentation, including very nasty, inflamed, crusty lesions involving the larger area of the skin. Sometimes you might see lumps or nodules scattered on different parts of the body, mainly on trunk and sometimes on arms and legs. So these presentations, especially the variation we see, need to be considered. The routine treatment for scabies is topical in form of 5% permethrin cream, which needs to be applied all over the body from jawline below. It's very important to apply everywhere, including underneath the nails, between fingers. In infants or people with immunosuppressive condition or elderly population, the whole face needs to be treated as well. Ideally, you can choose an early evening, apply the treatment for all members of the family before changing the clothing and bed sheet. The treatment might need to be repeated in a week's time. There are some other topicals in case permethrin is not effective. In some cases, we can try oral medicine called ivermectin. Here, I would like to emphasize on a very important fact. Not all the cases with no successful outcome after application of permethrin is because of the resistance to the medication. In fact, you need to make sure you apply it properly. you treat all members of the family. If you wash your hands after application of permethrin on your whole body, you need to reapply it on your hands. It's very important to follow the steps very closely and carefully. Sometimes the itch can continue even after successful treatment of the condition, which could be for several weeks. What is important here is to consider some other conditions which can be triggered by scabies, such as urticaria. So in those cases, you need to moisturize the skin. My suggestion would be a urea-based moisturizer, which can help with removing the dead part of the skin as well as moisturizing the skin. You might also need to take antihistamine regularly, which could be more appropriate to use a non-sedative antihistamine, such as fexofenadine. Finally, it's very important to consider other possible differential diagnoses, such as eczema or contact dermatitis. So a very thorough history to make the right diagnosis is important, and in fact is as necessary as thorough examination of the skin.